How much do people need to try before it is acceptable to pick behavioral euthanasia as an option for their dog? That is the essence of this question. And for context, this good faith question was left on the video where I stitched the creator who was saying that anxiety can be trained out of dogs. And this commenter is suggesting that that original video stemmed from someone who opted for behavioral euthanasia for their dog after only trying to muzzle the dog. So as someone who has supported multiple families through the decision of behavioral euthanasia, I would like to offer some insight. In short, there is no such thing as trying everything. There will always be something else to try, whether it's a different trainer, behavior therapy, different management solutions, different medications, different specialists to investigate potential pain or discomfort, because up to 80% of behavior cases involve pain or discomfort. And finding appropriate support, be it medical, behavior, a combination of the two, accessing those specialists, investing the time and the emotion into these cases. There is a huge amount of privilege involved in being able to pursue the options of just management or management and training. You need finances, you need social support, you need physical space in a home. You need access geographically to appropriate medical and behavior support. Virtual work helps with a lot of that, but it doesn't necessarily help with all of it, especially the medical piece. And everyone's situation is drastically different. And so it's really impossible for us to judge what we would do in someone's shoes because we're not in their shoes. Someone with a flexible work schedule who is comfortable financially with a robust emotional cup and social support is in a very different situation than someone with multiple children and other pets in the home or other vulnerable populations, a limited amount of space, a limited amount of time, and a limited amount of finances. And then, of course, there's the actual behavior of the dog and what we deem sustainable or an acceptable level of risk is heavily influenced by our own life experiences and beliefs. My job as a behavior consultant is to help people with a risk assessment, to help them consider all the sides of the case, and then to decide if it is safe or sustainable to work on just management and training, returning the dog to a breeder, to the rescue, to the shelter, or rehoming the dog, or behavioral euthanasia. The vast majority of my client population is not eligible for option number 3. There are many, many reasons that a dog may not be eligible to be rehomed or to return to a rescue or shelter, and I'm happy to make a separate video on that if anyone is interested. But for here, I'll just say that's typically not an option for my client population, ethically speaking. The general public is fortunate enough not to be in the behavioral euthanasia club, right? That's the club no one wants to be a part of. No one wants to have joined that club. It's kind of like the dead parent club. And there are 2 things you will often hear in this circle that I think are really important and relevant here. The first is that there will always be something else to try. So that is not a good barometer for the choices that are to be made. There will always be, again, another medication, another specialist, another trainer. None of that matters if it's not safe enough. None of that matters if it's not sustainable enough. And when we're considering risk and well-being, we're considering that of the dog, of those living in the household with the dog, including other pets, and we're considering the risk to society at large. And those risks will be different for every case, every individual dog. Sometimes the dog poses a big risk to society, and if they were to get out the door or get out of the gate, things could be really bad. Sometimes the risk is to children or other pets in the home or family members in the home. And sometimes we're talking about the quality of life for the animal itself. These dogs are often suffering greatly. And then the other really important piece here that you will often hear in these circles from people who have had to choose BE or who have had that choice taken from them, you don't have to wait until the worst day. You don't have to wait for the worst case scenario to happen to choose BE or to have BE chosen for you. And I think that's really important. And it's not something that people consider if they aren't part of that club. What does the worst day look like? And are we just waiting for that? And if so, it might be time to reevaluate the options. My job is never to tell someone that they should choose BE. Again, my job as a behavior consultant is to walk people through their options so that they can assess risk, and make a choice that is right for them and their situation. But I would say the hardest part about BE, aside from the actual loss of the pet, and make no mistake, none of those options are easy. They are all gut-wrenchingly hard. People do not make a choice here and feel good about it. We're just looking for the option that is the least bad. We're looking for the option that considers everyone's well-being and makes a really hard choice. The hardest part is the worrying about other people, other friends, family, trainers, veterinary professionals. People worry that they are going to be judged for making this impossible decision. It's kind of like fat phobia, where the biggest risk of being fat is actually the social perception and the way that you're treated. There are some parallels here. And so I would strongly encourage you, if you have never had to be in the BE club, when you encounter such stories where someone has had to choose BE, I encourage you to approach with compassion and empathy and be grateful to not be able to relate.